Hey, what's going on, everyone? Brad here with Top Tier Physical Therapy. Wanted to go over one of my favorite lower extremity exercises to give some of my clients and patients, especially for someone that's dealing with some kind of hip or knee issue. The exercise is a variation of a regular step up, and it's called a crossover step up. So it's exactly as it sounds, crossing one leg over the other, performing a step up, and I'm going down the opposite way that I came up. I like this exercise for a few reasons. One, it's very functional. So it's a step up. It's something we do on a regular basis, going up and down stairs, on and off of curbs, and then sometimes even getting into and out of a tall vehicle. Another reason is it's unilateral. So it's asking one side to do all of the work. A lot of times if we have a hip or knee issue and we're performing some kind of bilateral leg exercise like deadlifting, squatting, or even jumping, we can sometimes shift off of this painful side, which makes it not get the work that it needs. So when we do this unilateral exercise, that leg is doing all of the work. It's not getting any help from my good leg. I like the crossover version a little bit more than a forward step up because it asks my glutes and my anterior knee to do a little bit more work. So when I come into this crossover position, my hip is flexing and adducting. We know the glute's primary role is to extend and abduct the hip. So when I come into this flex and adducted position, I'm really stretching out those glute fibers. And then when I perform that step up, my glutes are working through a little bit bigger of a range of motion versus just doing a regular step up. The way it targets the anterior knee a little bit more is that when I come over into this crossover position, my knee is coming over my toe. Knee over toe is a safe position for almost everyone, but if you're someone who deals with a little bit of knee pain, maybe a forward step up is better to start with. When I go into this knee over toe position, my weight is on my forefoot, so I'm going to be asking my quads to do a lot more work as I step up, but I'm also going to load some of these anterior knee structures like my quad tendon and my patellar tendon. So when we have some type of tendinopathy, we need to load these tendons to get them to calm down and not be painful. So when I cross over into this position, my knees over my toe, as I first step up, a lot of force through that anterior knee, asking my quad to do a lot of work, and then my glute will also kick in as well. So different variation of a regular step up. Regular step up is a great exercise still, but a crossover version is a good way to start to target those hip and knee structures a little bit more.